Good afternoon, everyone. My name is Ekwabam Marachi, and today we are going to be talking about clinical assessment for rehabilitation psychology. We have already discussed rehabilitation psychology to be the process, a specialty area in psychology that is aimed at maximizing the independence, the functional status, the health, and the social participation of people with disabilities and chronic illnesses. Now we're going to be talking about clinical assessment. One thing to note is that in clinical assessment, you must be careful about the words. There is caution with labeling. Words like idiot, words like moron cannot be used when referring to people with disabilities. You can also not say words like this person is blind or this person is deaf. You must use words like this person is visually impaired. That enables us to, speak well about the person with disability. We should also be careful about how we talk about them, how we just label their disability. When we say the person with disability, we are more of regarding the fact that disability is an aspect of their life rather than something that takes over their whole life, like when we say a disabled person. So now to the topic that we're here for, clinical assessment. So what exactly is clinical assessment? Clinical assessment involves collecting information, and this information is collected through psychological tests and inventories, through clinical observation, through clinical observation, through neurological tests, and through interviews. Those are the ways by which we can collect this information. And this information helps us to be able to diagnose the person. This information helps us to be able to create a treatment plan, an effective treatment plan. Because one thing about rehabilitation psychology is that it has to be structured to the unique needs and goals of the person with disability and chronic illness. So it has to be something that is individualized, and that is what this clinical assessment helps us to do. Clinical assessment involves assessing the person as a whole. In our last video, we talked about psychosocial assessment, we talked about cognitive assessment, we talked about functional status assessment, we talked about all those things. And what clinical assessment helps us to do is to cover the entirety of an individual, and it helps us to know how to create a plan, a treatment plan, how to work towards helping that person using individualized and unique goals. Now to the methods of clinical assessment, we have observation. Refers to watching and recording of an individual while they are performing or living or acting or doing what they are supposed to do. So it is a process by which there is systematic watching and recording of behavior. Now, this can be done naturally or through the laboratory. So natural observation involves observing this person in their natural environment. So if you want to observe how a visually impaired person acts in school or behaves in school, we'll go to that person's class, we will sit down in their class while they are doing what they are supposed to do, and we will be recording or taking notes while we are watching what they are doing. That is naturalistic observation. One thing about this observation is that it increases generalization, but it is also at risk of observers bias. Now, a more structured or a more standardized way of doing this observation is by laboratory observation. Now, in laboratory observation, we're going to recreate this setting. We're using an artificial setting. So in the same case of trying to observe how visually impaired people work in school setting, we might create a school setting in the laboratory, but this time it will be a more standardized way. We'll use a more objective and standardized process. We might arrange the chairs, sit down, and then ask them to behave as though they would do in a classroom. And this laboratory observation allows for better control. So it allows the researcher or the rehabilitation psychologist or whoever is performing the assessment to have better control over the variables. And one thing we must note is that reactivity can affect observation. What is reactivity? Reactivity refers to how an individual sees, or how when an individual knows that they are being observed, when they are aware of the fact that observation is going on, and this can make them want to conform to to expectation, to perceive the expectation. So if the person that is visually impaired knows that you people expect to see him performing well, at school, or being able to navigate all the way at school, he might, try to do as if he knows how to do it. That is reactivity taking place. Or if they want to present themselves as, in a positive light, in a positive outcome, that is also an aspect of reactivity, because they are no longer being themselves. They are no longer just doing things as they would. They are trying to more fine tune it to present themselves to the positive light, to the researcher or the person doing the assessment. And that will lead to, problems in diagnosis, problems in creating a treatment plan. Because when this person has fine tuned themselves to being perfect, or to being able to do what they are not able to do actually, you might skip over it. You might be like, okay, this person is able to do it, we don't need to go over that part. Meanwhile, it's something that we actually need to go over. It can also make the person shy, it can make the person timid, it can make the person, shy away from doing things that they normally do in that setting, which can affect, assessment, because you might think that something they are not able to do. You might think that they're not able to do something that they are actually able to do. Another method of assessment is clinical interview. Now, clinical interview involves is a face-to-face encounter between the mental health professional and the client, or the person with disability and chronic illness. And it can be done in three ways. It can be structured, it can be unstructured, and it can be semi-structured. Now, in unstructured, is an open-ended. They are open-ended questions, which means that you can ask any question, you can go in any direction, just to see how the person with disability is coping, or how the person with chronic illness is being able to navigate the challenges that come with disability and chronic illness. We also have the structured interview. Structured interview means there's a clear and there are clear and set guidelines, which means that every question has the way to be answered, the way to be scored, the way to be noted. One thing about this is that it helps to, prevent bias from the researcher or from the person that is performing the assessment. But it can limit how much you let the client to express themselves. So usually when somebody is performing an interview, the person might be talking about something, and because it is not in the clear guide that you're giving, you might shut it off. You might just be like, no, next question. And that has limited information that might have been useful in diagnosis and creating a treatment plan. The next one is the semi-structured. And what does the semi-structured imply? Semi-structured implies that the interview is structured, but when you notice that there is something there is more information coming through, you can let this information flow. So you might have a list or a guide to direct you on how you should move. But if you are going through that guide and the client starts to discuss something more important, or starts to speak about something that you feel is useful in your diagnosis and creating a treatment plan, then yes, it is possible for you to now engage that person and move towards the evaluation and assessment of whatever the person is then speaking about. The third one is the mental state examination. Now, mental state examination is defined as the measuring the cognitive, the emotional, and the behavioral state of the client at that moment. So we're going to measure, there is time. We're measuring, can the person tell the time now? Can the person count? Can the person do like some sequence counting? We're measuring the person's appearance. How does the person look? How is the person sitting? Are they shaking? Are they timid? How are they moving? How are they behaving? All those things are measured during the mental state examination. So we're trying to assess the appearance and the behavior of this person. We're trying to understand how they look. There's a certain way they could look that make you know that, oh, is this person doing okay? Is this person doing fine? We're trying to examine their thought processes and their content. So if we're seeing some disorganized, disoriented thoughts processes, we're trying to assess that more, like, why did you say this? Why do you think this is this? Or why are you unable to say this? Why are you unable to do this or act in this way? Then we're trying to see their mood and their affect at that moment. Maybe they come in sad, maybe they come in really annoyed, really pissed, really hostile. We are going to note that down. We're going to keep it in our assessment books as well. The next one is psychological tests and inventories. And now, what do psychological tests and inventories do? These measure behavior, and they are standardized ways of assessing personality, social skills, ability, emotions, and behaviors. Personality tests are very important because they are standardized. What does standardized mean? They are reliable, they are valid, and they have a clear cut, scoring and interpreting process. So when they are, what does reliable mean? Reliable means that this test, it measures what it measures. If you repeat it, it will give you the same result. So it's the extent to which the measure can be repeated to give the same result. So when the test is reliable, assuming I test for something on a person, if another psychologist tests or replicates that test, it should give the same result. That's what a standardized test does. So it's not that I test something and I get a particular result, and you test something and you're getting another result. When both of us test something, it should give us the same result. Results should be replicable. Then validity. What does validity mean? Validity means the extent to which a test measures what it is supposed to measure. So if this test is supposed to measure intelligence, it should measure intelligence. If this test is supposed to measure maybe, what can I use apart from intelligence? Like maybe cognitive skills, such as maybe attention, then it should measure the attention of the person. This test should measure exactly what they are supposed to measure. It should also be scored and interpreted in a particular way. It should not be left to the psychologist or the researcher to just score it however they want to score it. There should be a particular guideline, a set of guidelines by which they are able to score and interpret these tests. The next one we have is physical examination, which is when you see your physician and they perform tests on how you are physically doing or how you are your physical well-being. Then we have behavioral assessments for assessing how they behave, how they move, how they act, how they respond to certain triggers or certain challenges or certain issues or the environment in itself. Then we have intelligence tests. Intelligence tests are used to measure cognitive functioning of an individual. We have intelligence tests. Well, exactly, that's it. Intelligence test. An example of intelligence test, we have the Stanford Binet test. So now we're going to go to clinical diagnosis, and right now, presently, there are two models that we can use to perform clinical diagnosis. We have the DSM, which is the Diagnostic and Statistical Manual of Mental Disorders, and we have the ICD, which is the International Classification of Diseases. The DSM is in the 5th edition and the ICD is the 11th edition, and that is what we use to diagnose people with disabilities and chronic illnesses. So these models are able to tell us how or what the symptoms that are needed or the symptoms that are required for us to say someone has a particular disability or someone has a particular illness. So what we are trying to explain by this is that the decision for us to say that this person has this particular illness or disability is based on how severe the symptoms are, the level of distress caused by the symptoms, and symptom salience. But we should note, however, that sometimes, not all the time, that you have all the symptoms that are written out in the DSM or the ICD. So it's not like they'll follow every single symptom written out. There are like so many symptoms under one condition. So it's not that every single thing will be ticked before you can now say this person has this disability or this person has this chronic illness. The fact that some symptoms do not show at all should not be used to justify limiting them to appropriate care. So the fact that maybe they don't have some symptoms doesn't mean that they are not experiencing this, doesn't mean that they are not going through what they are actually going through. So it just requires a mental professional actually going in depth to understand the severity, to understand the level, to understand the distress caused by these symptoms, and be able to make appropriate and accurate diagnosis. So for seeking treatment, when should we seek treatment? The first thing says if we feel sad, angry, and not like ourselves, if you experience social withdrawal or changes in sleeping patterns. So if you feel like there are immense feelings of sadness, there are immense feelings of depression coming at you, or if you are feeling that way. So maybe, like, we talked about, we are going to discuss mourning. So if you are feeling like you are grieving something like loss of function, loss of abilities due to this physical, this disability or chronic illness, you're feeling like you have missed out on something or you're grieving something, then you should seek help, then you should ask for help. Also, if you feel like you need to engage in substance abuse to cope, or you need to engage in abuse of food to cope with the issues, like you need to be high to forget about the issues, or you need to eat too much to forget about the issues. If you feel that need, or you are actively engaging in that, then you need to seek treatment. Also, grieving period, just like I talked about, when there is a loss of function, there is a loss of social ability, loss of function could be maybe this individual was able to move before, but now it has an impairment and they are not able to do all those things that they used to do before. They are track stars, or maybe athletes that love running and enjoy running and maybe make a living out of running, then they are grieving this loss. They are grieving the loss of function. They are grieving the loss of maybe social ability, because these are the activities that they used to engage with their friends. Half of their friends might be track stars, half of their friends may be athletes, and now they are unable to do the things that they love to do with their friends. This is a period of grieving, and if you feel like you are in that period of grieving, then you should visit a rehabilitation psychologist. Then if there is a traumatic event such as abuse, crime, accident, chronic illness, then there should be a visit or seeking of treatment. Then if you have stopped doing things that you enjoy doing, if an individual used to love doing certain things before, but now they don't feel the need to engage in it, that can be, a sign of depression. That can be a sign of worse or negative consequences to come. Individuals should make sure they seek treatment when they experience such things. Thank you very much.